topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good afternoon, Illinois. Welcome to another Ask the Expert show. This is the place where we bring you the finest experts in the field of legal, health, financial, and home improvement. Do I have a surprise for you? We had been inundated by your letters saying, how come you're not doing a Medicare show? Well, first of all, you've got to find the perfect expert when it comes to Medicare. And we really didn't have an opening up until last month. We found one of the finest experts in the field of Medicare. And I am so excited about this first show, especially because we can bring you an expert. And this is the time of the year. Let me introduce you to our new expert, Kylie Malden Adams. Name for her company is Health Journey EMS. Good afternoon, Kylie. We did it.
Yes, we did. Yes, we did. Good afternoon. Good afternoon.
Sure.
Thank you for having me, Stephen.
So good to see you. You know what? I was looking at your resume. You have, when it comes to schooling, it's been amazing what you've done with your life.
It is. It wasn't the easiest, but you know what? I like to think of myself as a curious person. I'm curious and I'm conscientious. I'm always seeking to learn. So while it was a lot, and I will say obtaining my master's was one of the hardest things, master's in health administration, but definitely rewarding. And I love the fields of healthcare. So I am just grateful to have been in a position to take those classes, get my master's, become certified, have all the licenses and all the accolades. So thank you.
With a child at home, you did all this.
A child and a husband.
First of all, tell us. Go ahead.
A child and a husband. So that's 2 kids. No, I'm just.
Yes. Now, so tell us about Health Journey EMS. What made you decide to start this?
So Health Journey EMS really focuses on health clinics, small to medium-sized health clinics who are in desperate need of operational efficiency. And that was really what my curriculum was on when I obtained my master's. Because I could see in all of the research that I had done that there are a lot of small to medium-sized clinics that are, in terms of, small and medium-sized clinics, you can think of that like a mom and pop shop, right? So like the person that owns the little grocery store down the street, those types of places really get ate up by big box places. And it's no different in the health industry. And so some of these little clinics wanted to continue their business. However, they just couldn't figure out the operational efficiency of it all. And so that's what made me decide to open up that consulting piece. And in terms of Medicare insurance, this is just one of the arms of my business.
Wow. You are a busy woman, I got to tell you. So let's get started because I've got so many questions. I shared with you that I was not educated about Medicare. I am so embarrassed. Here I have a show called Ask the Experts, And I had a friend of mine who asked me, he said, you have Medicare, don't you? And I went, no. He said, but you're eligible. And I went, I am? I didn't know that. And I got to tell you, I missed a whole year because I was uneducated. And we are going to be teaching you every month about Medicare. So, Kylie, tell people what Medicare is.
Okay, so Medicare is a federal government funded health program. It's, that's the easiest way to explain it, right? You will have had to have worked at least 10 years in your life to qualify for the program. Now, I said it in a very easy way, and anybody who is on Medicare or anyone who has ever tried to research and understand the subject, it is lengthy. It is a lot of information, but that is why I am here and the people that I work with. That is to help people understand in all of its fullness Medicare. But the very easy way to understand it is that it is a federally funded program that if you have worked at least 10 years in your life, you qualify for.
Well, that also means then that the government has their hands in this, and there's got to be all kinds of problems. But I have really enjoyed being on Medicare.
Mm-hmm. Mm-hmm. I mean, it's a robust program, and of course, there's going to be some complexities to it. You're right. If the government creates a program, there's many layers to it, and that's why I suggest that people work with someone like me to understand it. Because what people really just want to know is, if I get sick, am I going to be okay? Am I going to be covered? That's really the main question that people usually have. And so the answer to that is, if you are Medicare,
I want to
yes, you are covered, but to a certain degree.
I want to tell people that you're the person like Kylie who represents you, who's your agent, is so important. I don't even know if I shared this with Kylie, but the first stage I had here in Florida, it was crazy. He never returned my phone calls. And you see these things on TV, Kylie, that you can get this, you can get this, and I had a lot of questions. And I got to tell you, this guy basically would just rewrite my policy without even talking to me. You've got to have somebody you can trust and who's knowledgeable, because there's changes every year, isn't there?
There are changes every single year. I do want to the number that is at the bottom of the screen, if people are trying to reach me, that number is incorrect. So if you have someone behind the scenes who wants to update that information, they can. I'm going to give you the correct telephone number. Just let me know when you're ready. It's 630-779-1972.
Oh, good. I'm sure Rebel will get that changed.
630-779-1972. All right. So thank you. That was quick. It's important to have someone that you trust. And I am very honest with clients because I am dedicated to extending the lives of our Medicare recipients. And I do that through a number of ways. The first way that I do it in the state of Illinois is I make sure that senior buildings around Illinois have different programs available for seniors so that they can remain active. The second way that I do it is through seminars. I help to talk to seniors about, what does an aging brain look like? Is it regular aging? Am I forgetting things at the right rate? Or is it accelerated? Am I in dementia at the dementia stage, right? I do it that way, right? Brain acuity. And then the last way is about helping them understand their insurance benefits. And for your experience, I'm very sorry that happened to you, but I'll tell you, and your audience should know, that typically if someone is perpetually changing your plan, it is only because they are trying to get more money from the state. every
Oh,
single month, every couple months, right? The plan that you get should be something that somebody sits down and talks with you at AEP, at the beginning of annual enrollment period, right? And they should be asking you questions like, what health system do you use? Do you have specialists? What kind of conditions you're dealing with? They should be asking you those questions at that time. The only time you should be getting changed out of that plan throughout the year is if you have an acute situation happen. Acute means you had to go to the hospital because something urgent happened to you. An example of that is I had a gentleman just earlier this week who fell last Friday, and the plan that he was on originally worked just fine for him up until that point. Because of that fall, he had some doctors that he needed to see, and we had to switch him out of the plan. But outside of that, if you're relatively healthy, you're not going to the doctor a lot, getting switched out of your plan over and over and over again really is a disruption to your health care.
wow. I got to tell you, I'm on a HMO, and my friends always said, "Oh, you're going to have to use doctors, that are in the system." I got to tell you, I've had nothing but good luck, Kylie.
That's good. That's it. HMOs are not bad. They're not,
Let's go.
the
Also, people,
HMO. I'm sorry?
go ahead. Go ahead.
They're not the old HMOs where you would have to physically get a piece of paper and run from your primary physician over to a specialist. Oh, oops, I don't have the referral anymore. Everything's electronic. So, again, your agent, having a really good conversation with that agent, they'll tell you whether or not an HMO is for you. They should be having that conversation with you.
Kylie, do you represent multiple companies or just one company?
I represent Humana.
Okay. Oh, that's who I'm with. And they're wonderful.
Well, thank you for
I'm
being a part of the Humana
I am.
family. Thank you.
Oh, I am. It's I forgot what it's called, but yeah, I'm on the Humana and I love it. I would never switch. I'm not trying to do a commercial for Humana, but they are amazing. I must get 20 calls a week from them. They're always catching you up on things, making sure you understand. And I love Humana. So it's I didn't even know that you just did Humana.
Yeah. Yep.
What about Medicaid?
So Medicaid.
Yeah, I love you. So people confuse Medicaid, Medicare.
Mm-hmm. Yeah, they do. They confuse it all the time. When you think of Medicare, think of federal. And when you think of Medicaid, think of state. Medicare is federal. Medicaid is state. Medicaid is a state-funded program for people who have low incomes. Very simple. So, Medicare is federal and Medicaid is state.
People saw that you were going to be coming on today, and we got a lot of text already, which is amazing for the first show. They want people wanting to know with this new bill that the president did, are people going to be losing their Medicaid?
So this is what I will say to that. I have not studied any new statutes. I am not aware of a new law, right? But what I can promise your audience is that I can take a look at it. And I come on once a month here, folks. So, but I will say this, it is at a different time. But, just hang out with Stephen.
Yes.
He'll let you know when I'm going to come on. Short story is, I have not studied any new statutes, any new laws, and nor am I a lawyer, right? or a congressperson or a senator, right? So I am not privy to what those changes are, but I can do my best to go back and take a look at it and see how I might be able to provide them with some answers.
Beautiful. Now, the annual enrollment period is coming up. Explain to people what that is.
So annual enrollment period comes every single year in October, every single year. And that is when all health plans have an opportunity to make some adjustments to the plan from the previous year, right? And so Humana has done an amazing job with making some changes to our plans. I am not at liberty to speak about that plan at the changes at this time. We can only talk about it at the AEP season. But all of the carriers, and when I say carriers, I mean all of the different health plans, have they make changes every single year. And annual enrollment period is when anyone who is on Medicare has an opportunity to take a look at those new plans.
Yeah, I got to
And it
tell
goes
you,
through December.
with Humana, it's kind of like opening up a present every year because I remember one year I got like $600 worth of over-the-counter medication.
Mhm.
And one year I get like $35 towards the groceries, and they
Mhm.
pay for my insurance. It's just every year it's different, and it's
Okay.
always I'm excited to see what they're going to do. I can't wait till October to see what Humana is going to do for the coming year. You know, we just got a text, Kylie. This is
Mhm.
really a good question.
Okay.
She said, you see a lot of commercials now for Medicare, a lot of national commercials
Yes.
with celebrities.
Mhm.
Some of the things they say on there that you get sound too good to be true. Are they?
So I have to be very careful about the things that I say. And so I don't know the specific commercials, but I am very aware that a lot of commercials come out, and a lot of commercials are targeting Medicare recipients, right?
Hmm.
And a lot of times things sound really great, right?
Hmm.
And so, what I would suggest to the audience is, kind of use your common sense, right? And then the second
Yes,
thing
right.
is find a trusted agent to let you know if what you have seen, is right there on the edge of false, right? Right there on the edge of false. In other words, um, contact us now so that you can see that you qualify for additional benefits. You may or may not qualify for additional
Right.
benefits, right? Because plans vary from zip code to zip code, right? And so just because you're a friend in one zip code, right, a Chicago zip code can qualify for a benefit. A person in Naperville, Illinois may not qualify for the benefit. And so those are very broad statements that you
I
hear.
didn't know that.
Oh,
I
yes,
didn't
those are
know
very
that.
broad
Even
statements
with
that
the
you hear.
same company, Kylie,
Even with the
it's still
same
by zip
company,
code.
even with the
Wow.
same company. That is correct.
So it's crazy to try to compare what you have with somebody else because if they're in a different zip code, they could have something entirely different.
Entirely different. And
Wow.
so the commercials are really broad, I would say, right? Because there's some truth to it. You could qualify for things. And they probably say you could, right? It's about semantics. It's about word choice. And so you really just have to kind of use common sense. That's the first thing, right? And then the second thing is you have to get a qualified licensed agent to sit down and someone like me to sit down and talk with you so that you know what's what. And I would say build a relationship with someone. Stay away from switching agents every year, right? Stay away from, different carriers approaching you and saying, oh, we can do this and we can do that. It really comes across as
Right.
abuse to me, elder abuse. And I'm just committed to ensuring that our Medicare recipients are treated like humans with respect, who have worked in the United States for over 10 years, contributed to our society, and they deserve the best when it comes to understanding Medicare and products associated with it.
Well, I got to tell you, I am so glad that we have you. I cannot believe that you represent the same company I'm with, because this is not a commercial for humanity. Trust me, this is to educate you, because I of all people know how important it is to have a good agent. And we were so lucky to find Kylie. Kylie, tell people how they can reach you.
Yeah, so you can just go ahead and give me a text. For now, I am currently building another platform. And so I want to wait till next month to share with Steve and his wonderful audience. I can't tell you how grateful I am to be here today.
Oh, you're a sleuzer. You're a sleuzer.
To have this broad reach, right? There's no better way than to do it through someone who is a professional and an expert in media. So I'm grateful for that. But I'll share my platform next month. Stay tuned. In the meantime, you can just go ahead and text me if you are looking for, having some questions answered or someone to represent you.
But the enrollment period starts in October.
That is correct.
And there's a window there too, right?
Yep, that is correct. It goes from October to December. Okay. That is it.
Kylie, again, we are so blessed to have you. Please thank your husband and your children for sharing your time with us. We will see you again next month, and we're going to have a set date. It's the second, I believe it's the second Wednesday or Tuesday.
Second Tuesday of every month at 9:25.
That's right. Kylie, thank you so much. We did it. Next time we're going to hit it right away. Thank you, Kylie.
All right. Thank you so much. Bye, everyone. Have a good one.
Thank you. That is Kylie Malden Adam, Health Journey EMS. That's going to do it for us today. We'll be back again with you next week with more Ask the Experts.
Thanks for tuning in today to the Ask the Experts show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.